Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. So, 22,000 PYQs. That is everything that you need to master for the NEETPG exam. You may enroll for any number of apps, face-to-face classes, whatever you do. But the fundamental way to become the winner in the NEETPG is how you master these 22,000 PYQs, 10,000 PYQs from the NEETPG past 10 years, and 6,000 PYQs from the FMGE, 6,000 PYQs of INICET of the past 10 years. Once you master these 22,000 PYQs, nobody is going to stop you to lose the exam. So, you need to be a winner. First, you need to know what examiner is going to ask you. So, with that, every day I give you around 150 PYQs in the form of single liners, and every PYQ is being classified as to which topic that it belongs to, and that's how you prepare for the exam. So let's make the great beginning. Today is the day 3 session, and in about 25 weeks, in 6 months, I'm going to make you the champion. Every Monday to Thursday, we have a PYQ revision class on the YouTube. So, doctor, adrenal gland, what is the shape? So these are the PYQs of the FMGE exam in the past 10 years. So already I finished the first 300. Now we are discussing further 300 to 450 in the today's class. Good to see about 8 online classmates. Please inform all your friends that Dr. Murali Bharadwaj is online with you. So the left adrenal gland is semilunar in shape is what you need to remember. So what is the adrenal gland weight? Simple questions, but in exam hall, they matter everything. So it is 4 grams is what you have to remember. Aortic hiatus. So where do you have aortic hiatus at what level, doctor? Every time you go to the NEETPG, this is one of the favorite questions of the examiner. So you should remember a very important thing, that is VOA, which means Voice of America. So vena cava opening is at T8, esophageal opening is at T10, aortic opening is at T12. So every time you go to the exam, definitely one question will recur and repeat on this, which you need to remember like a parrot in the tomorrow's exam. Now, if you look at the phrenic nerve opening, the right phrenic nerve passes through the caval opening of the diaphragm, through the vena cava opening of the diaphragm. The right phrenic nerve passes, the liver, right? The right atrium, the right ventricle, everything on the right side. So that is the reason the right phrenic nerve typically passes through caval opening is what you have to remember. So inferior vena cava has valves to prevent the backflow of the blood. And at what level is the inferior vena cava formed, doctor? L5. Please don't forget, L5 is the level at which the inferior vena cava is formed, is what you have to remember. Now, at what level is the portal vein is being formed? The superior mesenteric vein, the splenic vein combine to form the portal vein. So the portal vein forms at the level of the L1 vertebra. L1 vertebral level is the anatomical level that you need to emphatically remember for the tomorrow's exam. So where do you see Brunner's glands? Brunner's glands are the histological hallmark of the duodenum. Duodenum is what you have to remember, where you see the presence of the Brunner's glands. So what do Brunner's glands will do, doctor, in the duodenum? Brunner's glands basically secrete the mucinous alkaline fluid in the duodenum. So fundamentally, stomach produces acidic contents. They enter into the duodenum. So somebody need to neutralize that. That's the reason in the duodenum you have the Brunner's glands, which typically produce the alkaline mucus, is what you need to remember. So tomorrow's NEETPG, they're going to give you an image like this and ask you to identify the Brunner's glands. So Brunner's glands are the component of duodenum. They are not the component of jejunum. They are not the part of the stomach. They are the part of the duodenum, is what you have to emphatically remember for the tomorrow's exam. Now, what are the relationships of the kidney? So typically, is there any muscle that forms the posterior wall on which the kidney will be lying? Yes, sir. Quadratus lumborum forms the posterior wall on which the kidney will be resting, is what you have to remember. Now, what is the relation between the kidney and the GIT? So you should know it is the duodenum second part. Duodenum has a first part, second part, third part, fourth part. So duodenum second part is present anterior to the kidney as a relation. So many times asked in the exam, you should remember that one of the favorite areas for the examiner is basically whether you know the relationships of the kidney or not. That's how by the time you finish 22,000 PYQs, you know what examiner wants. You don't need any other coaching, right? So stay with me every day. Monday to Thursday, we spend about 5 to 6 hours of time totally. And in about 25 weeks, I finish in 150 hours. The revision of all these 22,000 PYQs is my promise to all of you. So it is the right kidney's anterior relationship is the second part of the duodenum. That's what you need to remember. So now, doctor, you should know what are the various areas and their relationship to the kidney. So let us say we have the left kidney, right? This is the right kidney. So there is an area which is meant for suprarenal. This is the area for the spleen. This is the area for the pancreas. Here you have an area for the colon. Here you have the area for the small intestine. So you should know all this because this is one of the favorite image-based question examiner is going to ask you in the tomorrow's exam. Similarly, on the right kidney side, you should know. This is the suprarenal. This is the area where you have the liver, right? This is the area where second part of the duodenum is in relationship with this area. And here you have the small intestine. Small intestine is what you remember. And here you have the colonic area. So tomorrow, in an image-based question, if the examiner gives you a particular area, you should know which is more medial, which is more lateral, which is on the left side, which is on the right side. Which are the structures which are anterior and posterior? Oh, everything you should be ready when it comes to the relationships of the kidney. Because some of you are going to become the urologists, renal transplant surgeons, and you are going to operate day in and day out the kidney. That's the reason kidney relations are the favorite area for the NEETPG examiner is what you have to remember. Now, if you look at the ascent of the kidney actually starts its journey from a lower part of the abdomen. So, the inferior mesenteric artery can stop the ascent of the kidney and that can lead to certain abnormalities is what you need to remember. So, one of the abnormality because of the stopping of the ascent of the kidney is the formation of a horseshoe kidney where the lower poles are both united with each other. So what is this called? What is the structure that prevents the ascent of the kidney, doctor? Inferior mesenteric artery is what you have to remember. So what does kidney cortex contain? It contains collecting tubule and the duct. Collecting tubule and the duct, which is the longest part of the duodenum. First, second, third, fourth may. Third part is longest. Second part is in relation anteriorly to the right kidney. These are the 2 points which you should not forget, doctor. So umbilicus, what is the dermatomal value? So you should know the entire dermatomal structure, how to map, nipples are at which level, right? And umbilicus is at which level. So different dermatomal patterns you need to definitely master. Umbilicus is very important. It is the T10 is the dermatomal value of the umbilicus is what you have to remember. Now, what is the commonest position of the appendix? Appendix hides behind the cecum. Retrocecal is the commonest position of the appendix is what you need to understand. Then what is the least common position? Post-ileal. Post-ileal is the least common position. Retrocecal is the most common position. For the location of the appendix is one of the favorite area of the examiner. Now comes the Kellogg's triangle. So you should know everything about the boundaries of the Kellogg's triangle. Cystic duct and the lever and the common bile duct, common hepatic duct, cystic duct. Cystic duct comes from the gallbladder. So cystic duct, common hepatic duct, right and left hepatic ducts combine to form common hepatic duct, and the liver. They form the boundaries of the Kellogg's triangle. So what is the superior boundary out of these three? It is the liver that forms the superior boundary is what you need to remember. So Dr. Kellogg's triangle, remember, it is also called hepatobiliary triangle. What is that called? Hepatobiliary triangle. So here you are having the cystic artery. Can you see? Cystic artery, right? Then इधर क्या हो रहा है? ये है liver. So liver is the superior boundary. Then what else do you have? You have the common hepatic duct. Here you have the cystic duct. So this is the typical inferior surface of the liver which forms a superior boundary. Then you are having the common hepatic duct. You have the cystic duct. Between the three, you are having the Kellogg's triangle, one of the favorite areas of the examiner, which you need to be very, very sure about. So if you take any vein, it has valves. But what is the specialty of our portal vein? Portal vein is valveless. Portal vein is valveless. You should not forget, right? Now, chief cells. Where do you find chief cells, doctor? It is the fundus of the stomach where you find the chief cells. So 22,000 PYQs को एक के बाद एक, एक के बाद एक, एक के बाद एक. By the time you finish mastering this 22,000 PYQs, 10,000 PYQs from NEETPG, past 10 years, 6,000 from the FMGE. FMGE, don't take it light, very important for the examiner. Because NEETPG examiner is a FMGE examiner, that's the reason very important. Similarly, INICET also 6,000 PYQs. 22,000 PYQs by the time you do revision with Dr. Murali Bharadwaj, Monday to Thursday. तलवार के तार के जैसे चमकना शुरू करोगे, and that is the point where you are going to be the winner. Now comes the spleen. What is the weight of the spleen, doctor? 7 ounces. 7 ounces is what you have to remember. Now, if you look at the rectum, the whole of the rectum is not equally mobile. Rather, the lower 1/3 of the rectum is the most mobile part of the rectum is what you have to remember. Oh, what is the length of the rectum? Whatever. It is 12 centimeters. You know, 30 centimeter scale, half of it is 15 centimeter scale. Imagine what is 12 centimeters. 12 centimeters is the rectum. So, a lot of you do rectal examination, you know how deep you can pass the finger. It is not 1 kilometer. 12 centimeters is the length of the rectum is what you need to basically remember. Now, the anal epithelium. What is it made up of? It is made up of squamous cells is what you need to basically remember. Squamous cells. Squamous cells is what you have to remember. Now coming to the anorectal angle. Who maintains the angle between the anus which is below and rectum which is above? If they don't have an angle, then all the feces will simply fall down. So anorectal angle is maintained by the puborectalis, which will be holding the anorectal area and then pulling it back so that rectum is above and the anus is below. And there is an angle between the two is what you need to basically remember. So that's the reason you should know, doctor. This is the coccyx, right? This is the rectum. And here you have the puborectalis, right? And this is the perineal body. This is the anal canal. And it is a puborectalis like a band is holding and maintaining the anorectal angle. Anorectal angle is what you have to understand. What is the nerve supply of auricle? Auricle का nerve supply आपको याद रहना चाहिए. Lower 1/3 of the auricle is supplied by the great auricular nerve. It is great, but it supplies lower 1/3. Lower 1/3 is what you need to remember. So you can remember, doctor, here is the area of great auricular nerve. Where is this? Lower 1/3. Here it is auricular branch of the vagus nerve. Here it is the lesser occipital nerve. And here you have the auriculotemporal nerve. So that is how the nerve supply of the ear is dependent, is what you need to understand. So where does the parotid duct open? Parotid duct opens into the upper 2/3 of the molar tooth. Upper second molar tooth is what you need to remember. Now, who opens the mouth? Who closes the mouth? Who opens the mouth? Lateral pterygoid opens the mouth. And who closes the mouth? Medial pterygoid closes the mouth. That's what you need to remember. So the opening of the mouth is caused by the lateral pterygoid. Lateral pterygoid will open the mouth is what you need to remember, doctor. So how you remember? What some way you need to remember for the tomorrow's exam. So the lateral pterygoid depresses the mandible. Depresses the mandible. It will make the mandible to go down, the lateral pterygoid. And it is helped by the anterior belly of the digastric and mylohyoid muscles. So three openers: anterior belly of the digastric, mylohyoid, and lateral pterygoid. All the three together will basically open the mouth is what you need to basically remember. Now, what is the sensory supply of the anterior 2/3 of the tongue? The anterior 2/3 of the tongue sensory supply basically comes from the chorda tympani and the facial nerve. Chorda tympani carries the taste, so facial nerve is anterior 2/3. So taste sensation from the mucosal membrane on the oral side of the tongue, is carried by the lingual nerve. Lingual nerve is what you need to remember. So any lesion affecting 6th, 7th, so you should remember 3rd, 4th. This is a favorite question of the examiner, doctor. Please don't forget. So if you are having, this is what? Midbrain. Then what do you have? Pons. Then what do you have? Medulla. So you should know what are the cranial nuclei in each of them. 3rd, 4th in midbrain. Whatever. 5th, 6th, 7th in pons. 8th is at the pontomedullary junction, actually speaking. Then 9th, 10th, everything else is there in the medulla. So this distribution of the cranial nerve nuclei is one of the favorite questions of the examiner, doctor. So where do you have 7th, 6th and 5th pons is what you need to remember. Right, doc? Now, the trochlear nerve is a nerve that decussates in the brain. Please don't forget. And trochlear nerve is the one which has a largest intracranial course because it decussates, na? So trochlear is 4th. 3rd, 4th from midbrain. So this side trochlear will go to the other side and courses out. That's the reason it has got a very long circuitous path, because it undergoes the decussation and courses is what you need to basically remember. The right vagus nerve, there is something called nerve of Grassi, which you need to know. The right vagus nerve gives rise to the posterior gastric branch called as the criminal nerve of Grassi. Criminal nerve of Grassi is what you need to remember. Why do you call? Because it is often missed when you are doing vagotomy, and that's the reason it will lead to the recurrence of the peptic ulcer disease, which typically responsible for the, in spite of doing vagotomy, there's a chance that the criminal nerve of the Grassi, which comes from the posterior branch of the vagus, which supplies the fundus, right? This will be missed at the time of doing vagotomy. Understand, doctor? So, because of that, this nerve of Grassi is called the criminal nerve of Grassi, because it will be missed. A criminal will be missed. He will escape, right? And that is the main reason which is responsible for the recurrence of the peptic ulcer disease, in spite of doing vagotomy, is what you have to remember. Now, it is a recurrent laryngeal nerve, typically, which pierces the thyroid gland, recurrent laryngeal nerve. Then superior ophthalmic vein, it is the one which passes through the lateral part of the superior orbital fissure. So once more, favorite question of the examiner. What are the structures passing through superior orbital fissure and inferior orbital fissure? What are the structures passing through greater sciatic foramen in the pelvis and lesser sciatic foramen in the pelvis? You need to be very, very sure about. So it is the superior ophthalmic vein which passes to the lateral part of the superior orbital fissure is what you have to remember. Then inferior orbital fissure. Both the infraorbital nerve and the infraorbital artery, both of them will pass through inferior orbital fissure. So, doctor, you should know. If you look at the superior orbital fissure, what are the various structures you should know? Here you have lacrimal nerve. This is frontal nerve. This is trochlear nerve. Then superior ophthalmic vein. Agreed? Then here you have the inferior ophthalmic vein. Then you have nasociliary nerve, inferior branch of oculomotor nerve, abducens nerve, and superior branch of the oculomotor nerve together. And here you have the optic nerve and ophthalmic artery. There is a common tendinous ring which gives rise to origin for the extraocular muscles, is what you need to basically remember. So the common tendinous ring fundamentally is a fibrous ring, which is the part of the superior orbital fissure at the apex of the orbit. And the optic nerve and ophthalmic artery enter the orbit via, how do they enter? Through the optic canal. The optic nerve and the ophthalmic artery is what you have to remember. All right, doctor? Now, the superior and inferior division of oculomotor nerve, the nasociliary branch of the ophthalmic nerve, ophthalmic branch of the trigeminal nerve, and the abducens nerve, they all enter the orbit within that common tendinous ring, and they pass through the superior orbital fissure is what you need to remember. So this is another way you can remember the various structures over here, right? I think the contrast is very high, right? The contrast is very high. We'll try to decrease the contrast slightly. Yeah. Brightness we can, I think we can decrease. Contrast is too high. Saturation is okay. Yeah, I think now it will be better. Right. I think now it is better. Earlier there was a more contrast. Right? Now, you have the inferior orbital fissure here. This is the sphenopalatine foramen. Sphenopalatine foramen. This is the body of sphenoid. Here you have foramen rotundum. You have the pterygoid canal, right? And this is called pterygoid process. This is called pterygopalatine fossa. And here you have the maxilla. And then this is called greater palatine canal and lesser palatine canal, right? So greater palatine and lesser palatine, this is called the pyramidal process of the palatine bone. So if you know this anatomy, where is inferior orbital fissure, where is the body of the sphenoid and the pterygoid canal, it will help you a bit. So doctor, please remember, all the structures you should know. Superior ophthalmic vein, lacrimal nerve, recurrent meningeal branch of the ophthalmic artery. And here you have the frontal nerve, trochlear nerve. Then here inside this tendinous ring, what do you have? Superior division of oculomotor nerve, nasociliary nerve, abducent nerve, inferior division of the oculomotor nerve. And here you have the optic nerve and ophthalmic artery, and this is the tendinous ring, and here you have the optic canal. Please don't forget, that is the story of superior orbital fissure. Yeah. Then here you have zygomatic nerve, emissary veins, then infraorbital vessels. Here you have the maxillary nerve, which is passing to the infraorbital canal, right? Then this much if you know about superior orbital fissure and inferior orbital fissure, yeah, so that is more than enough if you know the various structures. So now, doctor, cranial nerve injury, any tumor which is there in the sphenoid bone, it causes the injury to the cranial nerve third, fourth, and first branch of the cranial nerve 5 is what you need to basically remember. Now coming to the phrenic nerve. So what is the root value of phrenic nerve, doctor? What are the favorite areas of the examiner? C3, C4, and C5. The root value of the phrenic nerve, which you need to remember. Now, cleft lip and cleft palate, they are the most common congenital anomalies, right? Because of the problem in the fusion of the various processes embryologically in the face. Now, which layer of the scalp is called the dangerous area? The loose subeponeurotic layer below the aponeurosis. The loose subeponeurotic layer is called the dangerous area of the scalp, is what you need to remember. And of all, it is the gallia aponeurotica, which is a tough layer of the dense fibrous tissue in the scalp. So, doctor, you need to know Scalp, what are the layers? All of us studied during our anatomy days to pass the exams. Skin. सबके ऊपर क्या है? Skin. Skin के बाद dense connective tissue. Then you have the epicranial aponeurosis. Then you have the loose areolar tissue. Then there is a periosteum. So this is how the various layers of the scalp, and you should know which is the toughest layer, which is called the dangerous area of the scalp, etc., etc. Right? Now, orbit. What is in the roof of the orbit? What is in the floor of the orbit? Medial wall of the orbit, lateral wall of the orbit. Everything about the orbit you should know. So the medial wall of the orbit is formed by the frontal process of the maxilla, is what you need to remember. And if you look at the muscles of the palate, what is the nerve supply? It is the trigeminal nerve which supplies the muscles of the palate. So doctor, if you look at the orbit, you should know this is the frontal bone, barabar? Then this is the optic canal. Here you have the ethmoid bone. Here you have the lacrimal bone. This is the palatine bone. This is the maxillary bone, greater wing of sphenoid. Here you have superior orbital fissure, inferior orbital fissure. Then this is called the zygomatic bone. So what constitutes the medial wall, lateral wall, superior wall, inferior wall? You need to be very, very sure about. So that is the reason you need to know frontal bone forms the roof of the orbit. Frontal bone is the roof of the orbit. Zygomatic bone forms the lateral wall and also a part of the floor. Barabar? Then sphenoid bone forms both the roof and also lateral wall. Sphenoid forms both the roof and also lateral wall. Then you have the palatine bone here, and maxilla forms the floor and also the medial wall. And here you have the lacrimal bone, ethmoid bone, then maxilla and the sphenoid bone. They're all the ones which typically form the medial wall. Medial wall is what you have to ultimately remember for the exam. Now, what is called the safety muscle of the tongue? Genioglossus is called the safety muscle of the tongue. And similarly, what is the safety muscle of the larynx, which prevents aspiration, right? So posterior cricoarytenoid is the safety muscle of the larynx. And what is the boundaries of the adult larynx, doctor? It extends between the adult larynx will be typically extending between C4 to C7, C4 to C7. So you will be doing intubation, endotracheal intubation, right? So you should know from which to which level is C4 to C7 is the larynx, right, doctor? Now, you should know that there is adductor muscles, abductor muscle. Only one muscle is called the abductor muscle, and that is what? Posterior cricoarytenoid is called the abductor muscle. Whereas transverse arytenoid, oblique arytenoid, lateral cricoarytenoid, these are called the adductors of the larynx. Isme abductor muscle is called, that is the posterior cricoarytenoid is called the safety muscle of the larynx, is what you have to ultimately remember. Then similarly, if you look at the tongue and the area around the tongue. So here you have the palatoglossus, and this is the styloid process. So here you have the mandible, this is the tongue, the frenulum, right? So here you have this genioglossus. This genioglossus is called the safety muscle of the tongue, is what you need to basically remember. Then you have the geniohyoid. This is the hyoid bone. This is called the hyoglossus muscle. Then you have the styloglossus muscle, stylohyoid muscle. So the various muscles in and around. But genioglossus is called the safety muscle of the tongue, is what you have to ultimately remember. So, doctor, with this we come to almost, we finished 300 to 350, right? So, hyoid bone. At what anatomical level do you have hyoid bone? It is the C3 cervical vertebral level where you are having the hyoid bone. So, doctor, in about 30 minutes, we are able to finish 50 PYQs. 1 hour may 100 PYQs. 150 to 200 hours may 22,000 PYQs. Whenever I get time, I come online and live broadcast it. So please tell your friends to also join. And remember, we have, please go to playscore.live, playscore.live. So we have three things. One is called the video library. So a lot of people have video library. So many popular apps are giving video library back. What is the specialty of our video library? We have totally around 350 to 400 hours of video content, that too in the form of 5-minute short videos, which you can easily revise all 19 subjects, conceptual level revision. So we offer this video library for 6,000 rupees of subscription. Then we conduct mock tests. So every Sunday we have a full-scale grand test and discussion. Every Friday and Saturday we have a subject-wise mock test and discussion. So totally 50 subject-wise mock tests and 25 full-scale grand tests we offer for a subscription of 6,000 rupees. Similarly, we offer notes where 70,000 high-yield facts are being provided in the form of 150 PDFs, which we will send you as the notes, which is being offered for about 6,000 rupees. So today only call our helpline, and in addition to this, we do a live discussion on the YouTube every day, right? Monday to Thursday, and try to finish 22,000 PYQs over the period of the next 4 to 5 months. So good luck for your preparation. रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे भाई मेरा number आ गया. So thank you very much. And today only call our helpline, go to playscore.live and then be part of our study group, right? WhatsApp study group. And I'm always there 24/7. Any doubts you have to mentor you. This is Dr. Murli Bharadwaj, your classmate, roommate, study mate, benchmate, for you to become the topper in the NEETPG exam. Thank you.